Hello dear patients, today we are going to review the case of spreading or growing of Molluscum contagiosum. I'll remind you that Molluscum contagiosum is a disease that is induced by a virus of the same name, Molluscum contagiosum, pox virus. It grows and develops inside the cells of epidermis, and as a consequence of that, infectious acanthosis develops. That is, the speed of multiplication of these infectious cells sharply increases. Therefore, we see such papules as you can see on the picture. A patient came to us. He had a removal of Molluscum contagiosum done before. It was not found in the area of sexual organs, where it was removed before, but in the area of lower extremity. In the thigh area, such rashes were found. These rashes should be differentiated from common pustule or folliculitis. However, in this case, dermatoscopy and observation were done, and still folliculitis is not located so closely. We see three rashes here. One is central, big, and two of them are located along the edges. Why do we see such localization? That's because there are two main mechanisms of Molluscum contagiosum spread. This is autoinoculation. Autoinoculation is when molluscum, roughly speaking, diffuses into adjacent skin, and it can affect close areas as in our case. So autoinoculation is the main way of molluscum spreading. Second way of molluscum spreading is the development of isomorphic reaction. What it is? This is when an intense itch or scratches take place. Then in this place Molluscum contagiosum appears. So in this case we see this autoinoculation. These are small papules of body color with a little small top. In the center of big one we can distinguish an umbilicate impression. It is characteristic that in comparison with common acne or folliculitis, such papules almost never fuse. In this case the patient was worried, as he removed Molluscum contagiosum before. However, at the present time it was the only one of existing elements. It is interesting to note that Molluscum contagiosum often manifests not straight away. Its incubation period varies from 10-14 days to 6 months. In our case, based on the history of this patient, they appeared approximately in 4 months. The incubation period is described as being 6 months and even more when rashes appear after infection. It's interesting to note that rashes may appear on different places in different time, and that's why such patients need periodic observation and removal of elements, and if they appear frequently, and there are many of them, then immune therapy is required after corresponding blood analysis. However, here the number of elements is limited, and we only did removal. By external amla cream we anesthetized these elements, and we removed it by radio wave method using surgitron apparatus. We have repetitively observed this patient in 2 and 4 months since the moment of this removal, and we didn't find any repetitive elements. I would like to show how such elements of molluscum spread. If it's necessary to diagnose and treat any neoplasms in the area of inguinal skin, sexual organs skin, you can consult dermatovenerologists and urologists of our paid medical center of Dermatovenerologic Dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such rashes. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.